Well, the backlog for healthcare services is bigger than ever before, growing by 1 million in the past 3 months alone. The Ontario Medical Association says this crisis should be a top priority in the upcoming election.
At this point, the wait times are just unbelievable.
The backlog created by the COVID-19 pandemic has grown to almost 22 million services. President of the Ontario Medical Association, Dr. Rose Zacharias, tells me patient care across the board is seeing major delays.
That includes hip and knee, cataract and hernia surgeries, as well as cancer screening, so mammograms and colonoscopies. Also, those school-based vaccinations for kids, and some regular checkups for high-risk patients that just have not had a chance to get back in and see their doctor.
Dr. Zacharias says wait times before the pandemic were already too long. She uses a lineup of people now waiting for knee replacement surgery as an example of how things have gotten substantially worse.
So knee replacement, you're saying that it went from waiting maybe a couple of months to people now having to wait a couple of years?
If even right now we stopped the clock and caught up on all the knee replacement surgeries that are currently in the queue, it would take us 38 months to catch up.
The drastic drop in service delivery likely reflects the pause on non-emergency treatments and procedures required by the highly contagious Omicron variant. On top of that, more patients are starting to re-engage with the healthcare system, and many are showing up sicker and with more undiagnosed health needs.
People with chronic medical conditions like diabetes, high blood pressure, underlying heart and lung disease have had those medical conditions worsen and become more severe while the system's been dealing with the crisis of COVID.
With Election Day just 2 weeks away, the OMA is out with a 5-point plan to help fix healthcare in Ontario. It includes a list of ways to reduce the backlog and shorten wait times, how to improve home care, and a plan to expand mental health and addiction services.
Ontario's physicians are willing to come alongside and to work with whichever party forms government beyond the election in order to implement the strategies that will provide better care for the people of Ontario.
Now, the OMA also graded the party's platforms on their health care commitments. The NDP had a slight edge with 11 stethoscopes out of a possible 18. The PCs and Liberals were tied at 10.